In November, there's going to be a ballot measure posed to the voters called Amendment D. And what that will do is it will expand Medicaid to 42,500 South Dakotans.
The South Dakota Education Association, we believe that healthier families will help students in our classrooms. There are over 40,000 adults who don't have access to health care. And by ensuring that they have more access, it will help their families. And expanding Medicaid will help rural communities deliver better health care for all.
Most of the patients that I see who are uninsured are typically working people. They might be farmers who again can't afford to, buy a policy on their own. They might be people who work in service industries.
It's a win-win. First and foremost, for our organization, it's going to save lives. It's going to increase access to those healthcare services to ensure that if you have a cancer diagnosis, that you can seek that care. And if we catch cancer early, you have a better chance of survival. So that's step one. The other step is the economic impact. Again, having those tax dollars that are coming back to our state, money that we're spending, that we're providing to the federal government, come back to our state, that we can invest here in the state with our state budget, but also it's going to ensure that we can keep rural hospitals open, provide those services to cancer patients, to cancer survivors. We all know someone that is presented with a situation where they want to make sure that they have access to that doctor. And so Medicaid expansion will do that.
And I think that we can all understand, because we all know somebody. We may not need Medicaid in our lives personally, but I guarantee you everyone knows someone who's in a situation where this could benefit them.
So I do hair for a living, which I love. I mean, I've built up a good clientele and I'm very close to them, but I've always had to have another job to supplement that, and I can't afford health care. I mean, I've had to skip my last 2 years of, physicals, pap smear, mammogram, and I worry.
I have many hairdresser patients who it's traditionally something where a field where you have to buy your own insurance, and they may not qualify for the exchange because they're in that gap, and so they're stuck and putting off care that they need.
Farmers Union is interested in making sure that there is rural health care across the state, and Medicaid will help do that by bringing in additional resources. We want to make sure that a farmer rancher does not have to drive 120 miles to get health care. Small communities in South Dakota need to have health care available to them.
Part of the deal on farming and ranching is the ups and downs. You'll have your good years, and then you have those years where you really get whacked around. And it's those years where you don't have enough money, and that's where the healthcare thing really, really comes into play. It's so important we figure out some way to take care of those bad years.
How does it get paid for? Well, we've got a great opportunity to benefit from federal funding, and we want to make sure we seize that opportunity that 38 other states across the country, including Minnesota, North Dakota, Nebraska, Iowa, many of our border states are taking. So right now, our tax dollars are going to those states. They're going to states like California and New York that expanded Medicaid. So we want to keep those dollars right here for those 40,000 South Dakotans so they can have improved access to health care coverage.
The way things are, we've got a lot of hard-working people. It's just slipping through the cracks. In this part of the country, we're known for values, for hard work, looking out for each other. That's who we are.